really gearing
I
up.
hear that, yeah, that's
Yeah,
great.
they've got, and there's a workshop Monday to help people
Yeah.
who want to help with that, to
Right.
learn about it. And they're hiring people to help register people. So, I mean, they're
That's
really
good.
on top of it.
We're gonna need, as much help as possible. And hopefully we're all operating off the same page and not getting conflicting information. But the other thing we're up against too is the Navigator money came into Wisconsin, all went to the east side. So we're not gonna have much here in western Wisconsin to play with as far as hiring navigators, trained personnel on the ground. And part of that was Walker rejecting federal funds in the past. So again, him trying to sabotage the whole thing. So I would hope with your help we can do some letters to the editor with facts, just helping people with facts and that. And then my office will be geared up. I know Tammy's office too is gearing up for all this. And then the forums that we're going to be having. This will be a work in progress, starting October 1 and then kickoff is January 1st.
What about the champions for coverage at CMS study HHS.gov? Do you think that's what Marilyn was talking about? Because I haven't gone to the website. Do you know about the champions versus the navigators?
Yeah, I think you were referring to the county health department though. weren't you? Right. Right. Yeah, and a lot of the county health departments are doing it. They're the ones who see most of the uninsured within the county.
So can you still be champions for coverage? Organizations can interested in conducting or supporting the outreach for the marketplace. You submit your application there. Do you know more about that?
And then CMS can get them information and help them as far as setting up various forums and events back in the district.
Okay, so that's not for single people interested, or that could
Well,
help educate? It's more of an
I have to check. I thought that was more organizational
Okay.
based rather than individuals going to it. But I don't know. It might also apply to individuals more. Pretty helpful too. Let's see.
I think related to that, people have to be very cautious because whenever there's a program like this, there are hundreds of people just out there waiting to take advantage of people. And I have seen several advertisements called, oh, we'll help you navigate through the Affordable Care Act. And really, the government will sign you up for some insurance that.
Well, premium tax credits don't go to the actual individual.
Right.
They go to the insurance company to help pay down the premium. So I don't think we'll have to worry about fraud from that point of view.
No, but I mean just unscrupulous people going to individuals and talking to them. I've seen that with insurance.
Yeah. And I've been very careful not to oversell all this. I've always said that healthcare reform, we had a system that was in desperate need of reform. The status quo was taking us to a very bad place. But the key to how well this works is our ability to study and collect the data to determine what is working and what isn't, and then making adjustments along the way. And I think if you talk to people in that way, they understand this is not something that came out down from Mount Sinai, etched in stone, that can never be changed. In fact, there have been many changes already in the Affordable Care Act, repeals and revisions to it, based on us learning more about what's working and what isn't. And we have to have that ability. But again, our Republican colleagues in Congress are making it very difficult for us to make adjustments and changes because they want to see it just fail. So they don't want to make adjustments along the way. And that's why you're seeing the Obama administration do executive orders trying to make some adjustments along the way. Jake?
The 25 or more states that haven't cooperated with the Affordable Care Act, is each of those going to need to be a separate risk pool, and if so, why? Because the one thing that the Republicans respond every time you ask them what the heck they have in mind is sell insurance across state lines. If you combine those 25 or 30 states, you'd have the biggest risk pool you could possibly think of, and I think it would drive rates down considerably.
Yeah, that's one of the provisions we did put in the Affordable Care Act. If states want to combine and create a larger exchange, they've got that option right now.
The ones that don't want to cooperate at all can, since the federal government is doing it, can't they just say, okay, we want a big risk pool?
Well, they could. HHS could decide to, if they want to have better risk management in that, have some states combine that. But right now, focused on the individual states, just trying to get those exchanges up there.
They'll still be bigger than any
I can see, at some point, Wisconsin, Minnesota, Iowa, given the similarities of healthcare coverage and the quality of healthcare, I can see us creating a much larger upper Midwest health insurance exchange if multiple states are participating. And now we're able to spread the risk even more and perhaps see more insurance companies participate then if they have a larger pool of potential customers. But last week we saw Wisconsin announce there were at least 11 insurance companies that would be part of the initial exchange, which is good. We have 15 in Minnesota, so it's right about where we were hoping the initial kickoff. Some are holding back for the first year, they're telling me, to see how things transpire first. But the key to this, I think we know this, is, as Jay pointed out, is how well you can spread the risk, which means getting the young and healthy in. And that's going to be the real challenge. They're immortal, they don't think they get sick, they don't think they get hurt, injured. Trying to convince them to sign up rather than just pay the penalty. It's going to be the real challenge. Because the more of them we can get in, and obviously those rates can come down and be spread out, and the risk adjustment will be manageable then. And what we found is reaching the young, especially young men, are very tough to get them to sign up for anything, let alone healthcare coverage. But the most dominant influencing factor in their lives are
Their
mothers. So there is a pretty sophisticated targeting campaign towards mothers having to get their kids to sign up for it. And there's a lot of talk about metadata and micro-targeting. This is exactly what HHS is going to be doing. Is trying to work through the mothers to get the young and healthy in.
There's a big criticism that I hear from the right that Obamacare is reducing employment, forcing employers to hire part-time workers as opposed to full-time workers. Would it be appropriate for Congress to respond to even that criticism, I don't think it's valid, by saying that employers have to pay a proportional benefit to all workers so that a half-time worker gets a half the benefits, so there's no easy out as opposed to a full-time worker, so that there's no incentivizing, to say, well, we'll just take part-timers like Walmart does or something, that everybody has to get a proportional benefit as a sort of equal protection under the law, so that there's no excuse.
Yeah. Well, first of all, we're not seeing any validation to that claim. The data just doesn't support it. Back when Massachusetts, when they said theirs up, it was just the opposite. Employers said there was an actual expansion of employer-based health care in Massachusetts, even though they set up their own exchange, and the national plan is pretty much modeled after the same thing. There are two things going on in the 30-hour rule. Obviously, you do have some employers paying very close attention to the employees over 30 hours. And then you've got the 50-person rule, small business cutoff. I can't tell you, and if we can accomplish just one thing, in getting our message out, I can't tell you how many small business owners have come up to me and just fear in their eyes that they're going to have to provide health care coverage for their workers. In fact, the construction crew that helped us rebuild our burnt-down cabin from last year, and Paul came up to me and said, I don't know if I'm going to be able to stay in business, Ron, because the requirement for me to provide health care coverage to my workers. So how many do you have? So I got four guys working for me as well. And if you're a small business, fewer than 50 workers, you don't have to. There's no requirement. So there's a lot of confusion with small business owners that they're going to have to fall under this requirement. And so there's just a lot of work that has to be done. And the clock is ticking with all this.
Do you want to just tell them about the SHOP program, Small Business Health Option Program for the small business? And they have a tab on health.gov.
Right.
Because that is the biggest question I get when I, come up to people. I don't know they're small business owners, and I have a shirt on that's doing Obamacare, and I'm saying I'm really happy about this, but I'm a small business owner. So I really think this, the SHOP program, if you have a few details about that.
Because of the HHS having to do 30 exchanges right now, the SHOP program is specifically for small businesses to go in and shop around. amongst competing plans themselves have been delayed. The Obama administration has delayed the implementation of that, which is unfortunate, but there can